And thanks again, everybody, for joining us. And what I actually thought I would do is let John go first. Safety's been our guidepost from the start, so we are constantly adjusting and modifying our plan to keep the campus as safe as it possibly can. And one of the ways in which we are modifying is that we're asking John to take his wonderful ability and knowledge and deploy it on our campus to do some wastewater treatment analysis. And John is the Elizabeth Howell Stewart Endowed Professor in Civil and Environmental Engineering. And he's also the coordinator of our Environmental Engineering undergraduate program. And you may wonder, what does wastewater have to do with COVID? And John, maybe you could just take a couple minutes and tell us, what does wastewater have to do with COVID? How can analyzing wastewater help us in our battle against COVID and staying safe? And then answer any questions the folks may have. And after that, then I'll be available to answer any questions about absolutely anything.
Fantastic. Thank you, President Galligan. I appreciate that introduction and the opportunity to talk about what we've been working on all summer. Again, like everybody, our plans changed. I was supposed to be on a study abroad in London this summer, and instead I've been measuring COVID and wastewater. So we have to adjust on the fly, and that certainly is the case with this situation. One of the tools we have in infectious disease is this wastewater-based surveillance. For a lot of diseases, when you get the disease, you excrete the virus or bacteria that are there. And so this idea of measuring sewage as a way to track disease is not a new thing. It's been done with polio. So you think of polio as being kind of eradicated from the planet, but even now, large-scale measurement of polio and wastewater is used to root out the last vestiges of the disease from the planet. So this is not a new thing. It's been used previously in the past, but many municipalities around the country and now universities are using this as a surveillance technique. Basically, the idea is that when you get sick, you start excreting the virus or shedding the virus, as we say, right away. And you continue to do that until really you have a negative test on the nasal swab, which you're all familiar with. So in that way, we can make measurements in different kinds of areas of town, or the sewage coming from a particular building, let's say in the case of a university, and tell whether or not someone is sick in the building or sick in that area of town. And that gives us an idea of how many people are there. It gives us another tool for detecting sick individuals, maybe people who are asymptomatic or maybe are reluctant to test. They can't really escape our ability to pick them up with this method. So we've been doing this in Baton Rouge since early June. The city of Baton Rouge and Rick Spear at the Department of Environmental Services has really been a partner with us. Rick has pushed us to make these measurements in Baton Rouge, and they've been very interesting, and I think illustrate really the utility of the measurement, because we've seen some really interesting things in measuring in Baton Rouge, and certainly I can show you that with a few slides if as we get further along in questions or discussions. But maybe with that as an introduction, I'll say that we've been in communication with LSU through the Office of Research and Economic Development, letting them know what we've been accomplishing, and have presented plans to them as we've gotten closer to the start of the semester. And shortly after, President Galligan's team reached out to us and said, okay, I think we're ready now to do this, but can you do it in a way that really isolates each individual dorm or each individual residence hall? And so what we've been doing over the past week is planning a network that will allow us to go to a certain place in the system, and that will collect sewage from a group of 350 to 500 students. And that size was picked because we really want to be able to encourage testing quickly if we see a dorm or a location that's of concern. And so we've designed a system with about 23 or 24 sampling points, and we're racing to get all that moving this week and next week. We'll have our first formal samples next week, but we're doing some testing this week in terms of whether we can do all those locations. And so that's the idea. We hope to be able to identify places in the campus where maybe we have outbreaks that haven't been identified yet, and quickly move to snuff those out as fast as we can. So with that, I'm happy to answer any questions or show you some of the Baton Rouge data that we have in the past, anything at all.
Questions for John?
Hi, this is Brianne Bizet with WAFB. Can y'all hear me?
We can.
Yes.
Okay, perfect. So I wanted to ask you guys, so when you do these wastewater testings, will they, show you guys maybe how many people for future events, like can be in a certain area, maybe even in a stadium or maybe even in a dormitory, because it may be too many people are in one certain area if more and more people are getting affected?
It doesn't tell us directly that kind of information. It really tells us, who in the building is shedding virus, essentially. And so if we wanted to make, any other judgments past that about the proper way to set a dorm up or the proper way to do that, that would be some other considerations as well. But it wouldn't tell us, oh, there's too many here or there's not enough here. But it just really tells us one simple thing, which is how many people in the building are shedding the virus or have the disease effectively.
Okay, and then one more quick question. So if someone does get the virus, or y'all can at least tell that there's a particular group of people who do have the virus, will they be expected to quarantine in their individual rooms, or do they have to go someplace else?
I don't know the quarantine procedures, but I know there's some people on the call who do. So President Galligan or one of the other team members.
John, actually it's a combination. There are quarantine spaces that are people who are quarantining in place where they can effectively do that. And really, one of the big issues in that, Bree, is the bathroom question. Do they share a bathroom? In which case, that makes it harder to quarantine unless you're sharing a bathroom with somebody else who's quarantining. So then those folks will quarantine somewhere else, either on campus or in a hotel off campus. The hotel issue has become a little bit complex because of our many friends from Lake Charles and Southwest Louisiana who were forced to evacuate. So hotel rooms have been very, very crowded.
Okay, thank you.
Other questions?
Hi, this is Nikandra Norwood from WVU New Orleans. Can you guys hear me?
Yes.
You can.
Okay, great. You mentioned telling you how many people may be infected. Can you talk a little bit about how you do those analysis?
Sure. So what we measure is the amount of genetic material from the virus that's in a liter of water. So it gives kind of a concentration. And there have been studies where people have measured how much of the virus people excrete during the disease. Now, there's obviously a lot of variability from person to person, but because we know kind of the amounts that people excrete while they have the disease, we can, by measuring the concentration and knowing how many people are living in the building, which we have, from Res Life has given us the number of residents in each location, we can make an estimate, something like, well, it looks like 1 to 5 or 5 to 10, or this looks maybe just like a single person who might be ill. And clearly, if we know someone is quarantining in place in that building, that may be something that doesn't concern us because we're already aware of people in the building that are sick. But if it's a building where we don't think there's been any disease or any reports of anybody quarantining, and we see elevated numbers, then clearly we have some options of things we could do to encourage testing, particularly, and educate the students that there's disease in that particular dorm or res hall.
So John, if we see an uptick, it won't necessarily identify the particular people who may be positive, but we'll be able to say, it looks like there are 3 people positive in this residence hall, and then we can move in and target our testing efforts on that residence hall.
Exactly. All of the things that LSU is doing all work together. The symptom check, the individual testing pods that we have on campus, this wastewater study will add a slightly different dimension that'll support those other activities, but they all have to be rolling for this to be effective, I believe.
Thank you.
Any other specifics for Dr. Pardue about the wastewater study?
I have one, Sydney Curran with WBRZ. Is the main thing importance of this that it can detect before testing, right? It's a preventative, or lets us know before y'all even get to the testing part.
Right. So the real key with this is we get a kind of it takes us a day or two to run the samples, but it gives us kind of an immediate picture. We pick up people before they may even be feeling symptoms. We pick up people, we don't have a testing delay, you know, that's there. And so in Baton Rouge, we've been about 7 days ahead of the numbers reported to the Louisiana Department of Health. So we've, for example, recently after the mask mandate started, 14 days after that, the numbers in Baton Rouge sewage dropped precipitously after the mask mandate. And we knew that really a week before the state knew it, because the testing has that delay built in. And we knew that was working well in advance of the numbers of cases dropping in Baton Rouge that we're reporting, just because we get an instantaneous picture of kind of what's going on in the city. And the same thing will apply. Same thing will apply to the dorms and the res halls.
And John, that's really important, especially with Sydney, what we heard from the Ochsner study that Pennington was also involved in a couple of weeks ago is so many people who test positive, especially in the younger age group, are asymptomatic. So somebody might say, well, I don't need to get a test because I feel fine, even though we want them to get a test. But John will be able to see what the sewage shows us, even if they're asymptomatic. So that's going to help us target before people are symptomatic.
Is there any way to have like a false negative in this type of research or findings?
You know, we measured below detection many times in Baton Rouge at the end of phase 1, before we moved into phase 2, across a wide swath of Baton Rouge. We couldn't see the virus at all in the sewage. So you can get down to, you know, hey, we've done as good a job as we can with this to where we just can't see it. But there is not a, you know, the method just picks up a real specific part of the RNA of the virus, and we don't see any positives unless we actually had that present in the system. So I don't think that's a problem here like it might be with some of the other medical tests.
Okay, thank you.
Mm-hmm.
All right, anybody else have questions? Or Dr. Pardue, you mentioned you might have some slides. Would you want to share any data or anything?
Sure, I've got a few things to show you just that might help understand the method. I think I'm disabled from sharing. I don't know whether I can be enabled to share.
All right, I added you as co-host. That may give you some more.
That worked. So, let me put these up on the screen and show you kind of a few things that might help along. Hopefully everybody can see that. Again, this is a joint effort between the College of Engineering and the vet school. Again, people who haven't worked together much in the past but know each other well, and have built this partnership to make measurements of. These different colors, what you see on the screen here, are a map of where the sewage that's put into the system at different parts of Baton Rouge goes. And I want to show you some data from this yellow hatched area, which is kind of in the center part of town here. So if you live in this area, your shower, sink, commode water all goes to the plant out on Gardier and Nicholson. And we sit at that pipe every day and make a measurement of what's coming through, and they can test that for the virus that's in this area. This is about 100,000 people, to give you an idea of the size of the number that's there. This is what these numbers look like at the end of phase 1, early June. You know, we had pretty significant virus in the community at this all the way on the left side. And the numbers really went to below detection right at the beginning of June. And then we opened up with phase 2. You know, we opened the bars, restaurants to some capacity, and it took about 14 days, but immediately then, as you know, we had this real run up in cases, and we could measure that in the sewage. The virus was really at elevated levels. In the first part of July, Mayor Broome and Governor Edwards then put a mask mandate in place. And it took about 14 days, but again, since that time, the numbers have dropped down to very low levels since the third week of July. So this shows you that we can pick up these big policy changes and how that reflects in the amount of disease that's circulating through the system. And we hope we can have some similar kinds of detections as we go along on the campus data as well. And the last slide, I'll show you just how do we plan a network. We have maps of the sewage system like any other utility on campus. And if you look at this series of dorms called the Horseshoe, which is a series of dorms that has about 490 or so students in it right now, all of those dorms drain to a single manhole. That manhole happens to be in the front yard of the French house, which is not the ideal, maybe not the ideal location sample, but that's where we'll go once a week to target the students that are living in this particular dorm. We'll have a sampler set up there for 6 or 7 hours, and that'll give us a good composite of everything coming from those individual dorms. And every dorm is different. Every dorm has a slightly different configuration in terms of where we have to go to measure, but we're experienced in working with these systems and have designed a network that'll do this for 22 or 23 locations. And so everyone that's sleeping on campus, every residence hall, every apartment, every Greek life house, all of those are covered by our sampling plan, and we'll be able to get these numbers for everybody on campus. So hopefully that gives you a little bit more of an introduction about what we're doing. And again, any follow-up questions, I'm happy to answer any of those that I can.
Thanks, John.
Okay, great.
All right. If anything comes up as we finishing up the call with President Galligan, feel free to ask Dr. Pardue as well.
Sure, I'll be monitoring the chat as well. Thanks.
All right,
I have one quick question. Do you guys have an update right now with COVID numbers as of today?
No, we'll release those numbers. Ernie, we release at 4 o'clock this afternoon. So there'll be a new report at 4 o'clock this afternoon.
Okay, perfect. Thank you.
You're welcome. Other questions for me?
Mr. Galligan, yesterday Governor talked about 20-25% inside Tiger Stadium. Do you agree with that and think that's going to be the most likely case?
I do agree with that. I know I told you last week to expect an announcement about football very soon. So I will repeat myself, expect an announcement about football very soon. I would add that I think the governor's done a fantastic job in leading us through this entire COVID crisis, that we're in conversation with him. We cooperate with him. He cooperates with us. In fact, he's my former student. I taught him in the fall of 1997, and as a teacher, I couldn't be prouder of a student than I am of the governor. So we really have worked together through all of this. He's been a partner in the conversation about what's the best thing to do, what's the safest thing to do. So yeah, we do agree, and we will be announcing very shortly. And Sydney, as I've said before, but I'll say it again, it's complex. It's not just about capacity. The planning process is complex. It's about what's capacity in the stadium, the outside part. What's capacity in the suites? How do we reorganize the suites to encourage people to be sitting outside and not staying in the suites? How do we get into and out of the stadium as safely as we possibly can? How do we switch to entirely cashless, paperless transactions? How do we modify concessions so that everything is predominantly a grab and go model as opposed to what we're used to? So a lot of work has gone into it, and that's in part what's taken the time. I would also agree with what the governor said yesterday, which is that it's still 2+ weeks away. So with John's help and the help of others, we will continue to monitor the numbers on our campus. And I know the LDH is monitoring the numbers in Baton Rouge and in the state. So things could change again, but I would, again, very soon.
And regarding testing, I know you guys said the latest numbers are going to come out at 4, but do you know how many tests you've done, or if you have a goal per week of how many tests, how many students and faculty you want to test?
We do, Ernie. I don't know those numbers off the top of my head, but we saw a significant uptick in testing. Jim Saborin and the strategic communications folks really got out the message: get tested, get tested, get tested. So we've seen those numbers go up. I think we can get those numbers for you, but I don't want to articulate them off the top of my head. My goal would be for everybody to get tested.
Period. And any hospitalizations?
I don't think we're aware of any hospitalizations. We don't ask people to report that, but I'm not aware of any hospitalizations. And I'm grateful for that.
Well, for you yourself, do you think with this latest wastewater research, do you expect testing to go up because of that?
Yeah, I do expect testing to go up because of that, because what we will do, as I said, is we see numbers from John's research and Gus's research and their team's research that indicates that there's an uptick in a particular place, then we're going to go in and we're going to say, get tested, get tested, get tested. And if the response is lackadaisical, then we're going to say, no, you got to get tested.
Someone else can go.
And we just want to keep encouraging students. We have the pods across campus and various locations, so they're convenient to wherever a student is on campus. They can, if they live off campus, they can drive in really quickly and get a test done, register in advance, and do that test. And we also, every day, we're asking people to do that symptom tracker. We want that data and information. So whether you live on campus or off, out of town, in town, we would ask everyone to fill that out, because we need to have the best data possible so we can track things and just make the best plans as we move forward.
Yeah, and I'll add, Ernie, that we also have National Guard testing sites on campus, a couple of National Guard testing sites. Since March, we've had a testing lab in the vet school, the River Road lab, and we've set up another lab in the vet school, which should be coming online sometime in the next few weeks.
This is Julie O'Donoghue. Can you hear me?
Yes, yes.
Dr. Galligan, or Mr. Galligan, I guess.
Yes.
So it sounds like there's agreement on the capacity at Tiger Stadium. Is the holdup questions about what's going to happen in the suites? What is still remaining to be worked out in terms of making an announcement? We keep hearing an announcement is coming soon. What's the conversation between LSU and the governor's office that seems to be holding up the announcement?
Yeah, I guess, Julie, I don't think anything's holding it up. I just think there's capacity is one part of it, but as I said before, it's a really complex issue. It's a really complex plan, and we want to have the best plan articulated we can when we say it. I'm sure it's going to change, but we don't want to articulate something that's kind of half-baked and has to change in significant detail. So that's really what's been the delay. And the other has been, again, is the reason the Southeast Conference moved to September 26th start was to buy ourselves more time to learn. And we continue to be learning all the time. So that's really it. And we've tried very hard throughout the COVID crisis I think LSU, athletics, the state, we want to give everybody as much notice in advance of our plans as possible. But since we're learning something every day, we don't want to be articulating a plan on Monday that changes on Wednesday, that changes on Friday. So those are really the reasons. And again, Julie, I apologize that I keep saying the same thing, but really the plan will be out. It will be out soon. We're still 2.5 weeks away.
No, I understand. The other question I have is, having been to Tiger Stadium, it's hard for me to imagine how even at a quarter of capacity, people could be sitting 6 feet from each other, because you sit so closely to each other when you're in there. Are you all confident that at a quarter capacity, people are going to be able to socially distance?
Yeah, we are confident they're going to be able to socially distance. We're also confident that, we're requiring that they wear masks. For everybody but the people in the suites, they're going to be outside. And even the people in the suites, we're going to get outside. And this disease does not do nearly as well in terms of infection rates outside as it does inside. So those are the reasons why we feel confident in the plan.
Okay, I do have one more question, but it's not about Tiger Stadium. You said that many hotels in Baton Rouge right now have people who have had to evacuate from the hurricane. And you made passing mention of the fact that many of those hotels were supposed to be used for quarantine if necessary for students. Are you all confident that you have enough places to put students who need to be in quarantine if those hotels are being used for another purpose?
Yeah, Julie, that's a great question. And we are, because our Res Life people have been amazing in terms of their adaptability, and shifting and creating extra available space by moving some people around. We talked to the health professionals about sheltering in place and said that was okay to do. So we are confident. But Julie, that y'all have asked me before about what are the things we're watching to see, okay, can we continue? And our ability to continue to safely quarantine and isolate is one of the things that we really watch, because it's a really important factor.
So can I want to make sure, are you guys, instead of having people quarantine in hotels, are you having people quarantine in their dorm room when you talk?
Yeah, we're having some people quarantine in their dorm rooms, and then we're having other people quarantine in other dorm rooms that are set aside for, or apartments that are set aside for quarantine space.
How does that work with people who are quarantined in their dorm rooms and the bathroom situation? The bathroom situation
is the limiting factor on quarantining in one's own residence hall. If you share a bathroom with someone who isn't quarantined, then you're not going to be able to quarantine in that space. Or we get in and we make sure that the bathrooms are washed regularly, but that's a big factor.
Hi, I just have one more question. Or does someone have another question I can ask ahead?
No, go ahead.
Okay. I just wanted to know if you guys were going to start letting the students know in those dormitories if there is a lot of cases that you've seen from the wastewater.
Yes, we will let them know, and we will say that we'll treat it. We won't treat it exactly like contact tracing, but we will say, yeah, please go get tested. Someone has been identified as positive in your area, or some number of people have been identified. We won't tell them it's free. We won't obviously tell them exactly who. I can. Good morning to you. Yes, that is always a concern. And I guess the answer to the question is not having too much fun, but the way one has too much fun. So big groups indoors without masks, not a good thing. Having too much fun outside with masks on or in smaller groups with masks on, not concerned about that. But we will certainly monitor the numbers very, very carefully as we get a week and 2 weeks past Labor Day. I can say anecdotally, while every Monday we hear about there was a party here or a party there, we didn't hear a whole lot of that after Labor Day. My fingers are crossed.
All right, anybody else?
I have some info. We've had 4,142 tests. That's self-report, the National Guard, and the pods. So tell your friends there's testing capacity available. Please go get tested.
President Galligan, Matt Houston, WAFB. Can Tiger Stadium still be Tiger Stadium with 75,000 fewer people in the stands?
It can, Matt. There's a magic in the air in Tiger Stadium, and that magic is contagious, but not in a negative way. It is a whole lot more magic with 105,000 people, but there's going to be magic with 25,000. And that's a whole lot more magic than with no football at all. But again, safety's our guidepost. So yes, it will still be Tiger Stadium, but like life has come to be, it will be different.
Can you describe the tenor of the meetings between LSU administrators and the governor's office and all the stakeholders that are involved in this? And perhaps what was the most complicated thing to figure out as far as the plan is concerned?
You know, I'm not in all those meetings, but the meetings that I've been in with the governor, the tone is conversational. The tone is information sharing. The governor is a person of substance and great intellect. I think we are too. So the conversation is at a very high level. He's also a lawyer, so he asks great questions. And we answer those questions and have asked questions back to him. And certainly the number one is been health, is what can we safely do? And we've also been looking at what are other schools doing and what are best practices elsewhere. So the conversations, I know I'm making it sound like Eden, but the conversations are good and the tone is great.
You guys have already kind of indicated that you don't want people on campus unless they have tickets. Can you enforce that without closing parking lots and putting people in those parking lots and checking tickets as people come on and off campus?
Yeah, I think we can enforce it, but I think the most effective way to deal with it is going to be we'll as September 26 approaches, is we just got to get that message out. We got to get that message to everybody that if you don't have a ticket, please don't come to campus. Game day activity on campus is not going to be the game day activities that you are used to. That will be very different. So I think we've just got to communicate that. We've got to get that word out. And then if we have to enforce it, our first enforcement measures will be gentle and persuasive. If we have to be more forceful, we will, but I hope we don't.
You mentioned earlier a little bit about expecting that some of these things can change. Do you anticipate that, for example, seating capacity could change 6 or 7 weeks into the season based on how the state's numbers are looking?
I would say I don't expect that, but I have come to learn since January 1st when I became interim, and especially March 11th or 12th when we decided to go remote, that anything can change at any time and pretty darn fast. Yes. I think that's from Jim. Is that the start of school? It's either the start of school or August 15th, Dion.
Yeah, I can check. I think it's the start of school, Tom, which
Yeah.
would be the 24th, I think, technically, but we'll check on that.
Thanks. And Dion, those numbers aren't going to vary much. The August 15th to the start of school aren't going to vary much because the testing effort really kicked off at the start of school. Yep. Then we have 77 in isolation and 108 in quarantine.
Can you touch on prioritizing tickets for Tiger Stadium? Are fans going to get, students going to get, majority as well as season ticket holders?
There'll be season ticket holders will get, will have an opportunity to get tickets. The athletics department will announce all that, but there will also be student tickets available. We will probably roll out a program where students, in order to be eligible for tickets, will have to say, hey, I got tested. Again, testing incentive.
Would they have to prove that?
Matt, we spent about a half an hour yesterday talking about, maybe 45 minutes, talking about how, in fact, we would prove that while preserving their privacy to the maximum extent possible. And a smaller group of the emergency operations team is looking at exactly how we would do that.
Hey Tom, it's Brooks Gavina from The Advocate. Is there any with Tiger Stadium, like with outside fans out of state, is there any conversation? I mean, people come from all over. How does that weigh into the conversation about capacity?
Yeah, Brooks, that's a great question. There is some conversation about that. There will be ticket limits. The number of tickets available to fans from the other school will be substantially limited. Harder for us to control someone coming from Texas, LSU alum who lives in Texas, who has season tickets. But again, if they stay safe, mask, distance will be okay. There'll also, Brooks, be the band will not be on the field before the game or at halftime.
Is the band still going to be in the stadium?
I think the band will be in the stadium if the medical task force continues to believe that that's safe for them to do so. Julie, they'll have if they are, they'll have horn covers, they'll have covers, they'll be in a special section, they'll be physically distant from each other, but we're relying on the SEC medical task force to advise us about the band and band safety as well.
If that's the case, I don't want to go down this rabbit hole, but is the band going to be tested? regularly? I mean,
Yeah,
because we're blowing
that-
into an instrument. So
yes. Another issue that we're discussing, that we've been discussing at the SEC level.
I actually want to go back to the quarantining and isolating of students. Has it been a shift? I don't remember when I read the original plan that students were going to be allowed to quarantine in their dorm room. Has that been a shift that's now allowed?
Yes, that has been a shift. We didn't know if we could safely do that, and then we asked our health advisors for a plan whether we could safely do that, and if so, how. And they came up with a plan to do so. You probably also remember that there's been some national conversation about not necessarily as your first step sending everybody home, but having them shelter in place. So we were motivated in part by that conversation as well.
Is that are you sheltering people in dorm rooms because of the capacity issues in the hotels? Is that why that came up?
No.
Like in your own dorm room, I'm sorry, as opposed to the special quarantine.
No, it came up because we were hearing from the national folks, from Dr. Fauci and others. Hey, should they stay in their residence hall first? Should they stay at the college first or the university? So we began looking at that, and then we obviously moved faster looking at that, knowing that Laura was coming and was going to hit Lake Charles. Okay, I've got updated data for you. Since the first day of class, the number of tests is 4,142. So that is the first day of class. Same number, first day of class. Thank you, Jim. Thank you, Ashley.
All right, we got about another minute, so I just wanted to see if anyone else has any last-minute questions, and also feel free to send any along to us after, and we can help facilitate that. So any last-minute questions before we wrap? All right, well, we appreciate President Galligan and Dr. Pardue joining us today, and all of you joining us. We will send more information on next week's briefing early next week. And again, thank you and have a good rest of your day. Mr. Galligan, do you have anything else you want to add?
No, I just want to say thank you to everybody. And as Ernie said, give us any feedback you have, and if there are ways that we can make this better, we're ready, willing, and able, and appreciate your time. Thank you.